My name is Tiffany Whitlow, and today I am going to be talking to you about something that, in my opinion, isn't talked about enough: anxiety. According to the Anxiety and Depression Association of North America, anxiety disorders are the most common mental illnesses in the United States, affecting 18.1% of the adult population every year. Surely we're all familiar with the general concept of anxiety, that feeling where your heart speeds up, it gets hard to breathe, and you just can't help but think that something bad is going to happen. But anxiety disorders go beyond just the occasional worrying. They interfere with your life and sometimes your relationships in ways you never would have imagined. There are many types of anxiety disorders, with one of the most common in our focus today being generalized anxiety disorder. According to the National Institute of Mental Health's overview of anxiety disorders, people with generalized anxiety disorder display excessive worry every day for at least 6 months about a number of things such as personal health, work, social interactions, and everyday routine life circumstances. Fun fact: women are twice as likely to be affected by generalized anxiety disorder. According to the National Institute of Mental Health, the symptoms of generalized anxiety disorder include feeling restless, on edge, wound up, muscle tension, difficulty controlling feelings of worry, irritability, and sleep issues. I was diagnosed with anxiety at age 6, but it really started affecting me at age 12 when I was in middle school, and I was just adjusting to the changes of going from, elementary school to middle school. It was a lot to get used to, and all of the social dynamics were new to me, so since then my anxiety has just been through the roof. Next, let's discuss some of the causes of generalized anxiety disorder. The exact cause is unknown, but genetics are thought to play a huge factor. Every woman on my mom's side of the family, including my mom and myself, have been diagnosed with generalized anxiety disorder, and most of us also have depression, so that's fun. Depression and anxiety go hand in hand, as they can often be the cause of the other. You get so stressed that you get sad, or you're so sad that your anxiety just goes through the roof. It's just, ugh. Particularly stressful life experiences are also a likely factor. While anxiety may seem to most affect the mind, it also affects the body. According to a Healthline article by Christine Cherney, August 25th, 2020, anxiety can decrease your sexual desire, cause stomach pain, high blood pressure, and muscle pains. Now, let's discuss some of the possible remedies for anxiety. There are a number of anti-stress vitamins and supplements which are available over the counter, but there is no such thing as a over-the-counter anxiety medicine. According to the Anxiety and Depression Association of North America, only 36.9% of those with anxiety are receiving treatment. Numbers of types of counseling are available for a cost, of course, for helping with anxiety. There's dialectical behavior therapy, or DBT, which I did. And according to a Healthline article called Dialectical Behavioral Therapy by Crystal Rapol, on January 25th, 2019, DBT helps people to build 4 major skills: mindfulness, distress tolerance, interpersonal effectiveness, and emotion regulation. Then there's cognitive behavioral therapy, or CBT, which takes a more short-term approach to the mental health treatment. The focus of CBT is identifying thought patterns and identifying how they affect you negatively. Psychodynamic therapy is the most common and stereotypical type of therapy, where the patient sits and talks one-on-one to a therapist about whatever may be on their mind. The therapist takes notes of these thoughts and tries to find patterns within them over time. From here, therapists determine the course of treatment, whether it be a diagnosis or a recommendation to a psychiatrist. The therapist may also recommend or put into action a course of treatment involving different methods of therapy, such as CBT or DBT. In some cases, no matter what medication is prescribed or what amount of therapy is received, it still may not be enough. Self-care is important for everybody, but it's especially important for those with mental health disorders. According to the Health Coach Institute, there are multiple types of self-care, such as emotional, spiritual, mental, and physical, to name a few. Meditation, journaling, taking a bubble bath, dancing to your favorite song, and trying new experiences are all great examples of the many types of self-care. I have just discussed the basics of anxiety, its symptoms, and its possible treatments. Although it only affects 18% of the population, anxiety is a disorder which should be taken and treated seriously. Be sure to check up on your friends and family if they have anxiety. Ask them how they're doing and what you could do to help. Everyone could use a friend.